Welcome back to the deep dive. So this is where we really try to distill the essential insights from the latest clinical research and tools. We want to give you a bit of a shortcut,
Right.
to staying well informed without it eating into your clinical time. And just for transparency, this deep dive is adapted directly from a clinician-written article on Mentalyc. We're bringing it to life in audio for those of you who, prefer listening on the go or while you're finishing up your charts.
Exactly. And today we're featuring the perspective of Nuria Higuero Flores, who is a psychologist. Her expertise is really what's guiding our discussion today on, well, the incredibly complex world of group alliance. And if you happen to be new to Mentalyc, it's a clinical intelligence platform. It's designed specifically to support licensed therapists with documentation and those actionable insights we all need.
So let's just jump right into that feeling. That feeling every group therapist knows, that kind of subtle knot in your stomach. You're looking around the room and maybe the energy is, mostly good, but then you spot it. Client A is sort of dominating the discussion and you see client B physically shrinking back, maybe crossing their arms.
Mm-hmm.
You can just sense this imbalance, but you don't really have objective data to pinpoint what exactly is going wrong for client B.
That is the perfect grounded scenario. I mean, we know intellectually that group therapy is this multidimensional matrix, right? It's not just the therapeutic alliance between you, the leader, and client B.
Right.
It's also that whole web of relationships among all 8 clients, and then client B's relationship to the group as a collective thing. You're trying to track and modify, like 10 interdependent relationships at the same time?
At the same time, exactly. And I know the core leader-client diet is critical. We use tools like the session rating scale, the SRS, which are, they're fantastic for one-on-one work.
Oh, absolutely.
But the problem is that group dynamics are just. They're too vast for that simple measurement. The SRS is only telling us maybe half the story about client B's experience in that room.
And that's the critical point, because relying only on your intuition is, well, it's high risk, especially when we know the stakes are therapeutic failure or, group dropout. If you miss that client who's shrinking for another 2 weeks, they're gone.
They're gone.
And this is exactly where the article introduces us to the solution, the group session rating scale, or the GSRS.
So if the SRS is the gold standard for individuals, the GSRS is really designed to solve this complexity problem. It's an ultra-brief, 4-item visual analog scale. But what's really fascinating is the philosophy behind it. Where did this tool even come from?
So it comes out of the Partners for Change Outcome Management System, or PCOMS. And PCOMS is really defined by this core value of client primacy. It emphasizes that getting continuous feedback from the client is, well, the single biggest driver of successful outcomes. That just makes so much sense. It really positions the client as the ultimate expert on their own experience.
Precisely. And pioneers in this space like Barry Duncan and Scott D. Miller, they realized group therapy needed a practical way to apply this philosophy, so they developed the GSRS. The key clinical differentiator is that the GSRS explicitly shifts the focus. It captures the alliance with both the group leader and the group as a whole. It really acknowledges that belonging to the group is a therapeutic factor in and of itself.
And the purpose is so immediate. I mean, if you have a measure that captures this multidimensional alliance, you're getting instant session-by-session feedback. So you can spot those potential dropouts, those quiet clients early, you can modify your strategy, and you can stop a therapeutic failure before it even starts to compound.
It's basically an early warning system. But to make it effective, they have to be really specific about why a client might feel disconnected. They didn't just ask, did you like the group today? They broke it down into 4 distinct, highly actionable pillars. Okay, let's drill down into those 4 components, because this seems crucial. A low score in one area would require a completely different intervention than a low score somewhere else.
Absolutely. The client just responds by marking a point on a little 10-centimeter line for each one. So first we have relationship. This is the core therapeutic factor, as you'd expect. It asks if the client felt understood, respected, and accepted by both the leader and the group. The anchors are, I felt understood versus, I did not feel understood.
And if a client scores low there, it's pointing to a fundamental rapport issue. The intervention has to focus on connection, on reflective listening, both from you and maybe even encouraging others in the group to reflect what they're hearing.
Correct, but what if the relationship score is high and they still feel disconnected? Then we look at the second pillar, goals and topics. This is all about alignment, about relevance. Did the group actually work on what the client wanted to address today? The scale goes from worked on what I wanted to did not work on or talk about what I wanted.
This is so critical. You could have perfect rapport, but if the content is consistently irrelevant to that person's core needs, they will eventually check out. A low score here tells you the intervention needs to be structural.
Exactly.
You have to adjust the content or the agenda for the next session to make sure the client's goals are being centered.
Then there's the third dimension, approach. This measures the fit between the therapeutic style and what the client prefers. It asks if the leader's and the group's approach is a good fit for me or not a good fit for me.
Now, that is interesting. A low score there doesn't mean the client doesn't like you. That's a separate score. It means they might be rejecting the method.
Right.
Maybe you're heavy on cognitive restructuring, but that client needs something more somatic. Or maybe they just hate role-playing. This demands a change in technique, not just more rapport building.
Exactly. It forces a differential intervention that's based on actual data. And then finally, they wrap it all up with overall fit. This is the global measure of belonging. Did the client feel like a part of the group today? It ranges from today's group was right for me all the way to did not feel like a part of the group.
That overall fit score,
Yeah.
it seems like the ultimate indicator of whether the group has really achieved cohesion and safety for that specific member. If that score is low, it feels like a red flag that the group culture itself might be excluding that person. Okay, so here's where the rubber really meets the road for us clinicians. Imagine having to track those 4 distinct scores for, say, 8 clients, week after week. That's 32 distinct points of feedback every single hour.
Yeah.
Relying just on memory or, scribbling this on a notepad and trying to synthesize it later. It's just a recipe for missing those crucial patterns.
That volume of data makes manual tracking almost impossible, especially when you're also focused on getting your documentation done. But the beauty of structuring this feedback is that it gives you this massive opportunity for reflection, but you do need help synthesizing it. And this is why the article actually notes the utility of Mentalyc's Alliance Genie. The GSRS generates the data, but Alliance Genie can help clinicians reflect on those session insights. It provides a kind of supervision-like support right inside your notes.
Oh, okay.
So it helps surface those exact patterns, which clients consistently score low on which dimension, and that allows you to connect the feedback to the clinical content you just documented.
So that makes the reflection piece organic, instead of an afterthought. Instead of just noting what happened, you're using that objective feedback loop to understand why it happened and, more importantly, what to change. Let's talk numbers for a second. The scoring is simple. All 4 items are summed for a score from 0 to 40. But I want to challenge this a bit.
Go for it.
If the relationship score is a perfect 10, but goals is a really worrying 5, the total score is probably still in the mid-30s. Isn't summing them a bit dangerous? How do clinicians make sure they look at the patterns and not just the total score?
That is an excellent point. And you're right, the total score isn't the final word. It's more like a quick red flag. Clinical experience suggests scores below 36 may point to an alliance issue. But the real power is in the subscale pattern, exactly like you described. If a client consistently scores high on relationship but low on goals, you now have a mandate to shift the agenda.
Right.
You don't have to ask, why are you shutting down? You can ask something like, I noticed you felt the topics weren't as relevant last week. How can we make sure this group centers your needs better?
It totally transforms the interaction from a personal confrontation into a collaborative problem-solving exercise. You're using their own data to prove their input is valued, which in itself increases their agency.
And we should also note the psychometrics. The reliability is really strong. But the most important takeaway for a practitioner is this. Research shows that higher GSRS scores predict greater improvement in psychological distress during the first 4 sessions.
Wow.
This tells us it's not a long-term measure, it's an early dropout prevention system. It's designed to force immediate course correction.
That really reframes the entire purpose. It's all about ensuring retention and engagement right out of the gate. Quick pause here. If the challenge of tracking these complex, multi-layered alliance patterns across several clients feels familiar, and if you're struggling to integrate that clinical insight into your required documentation, Mentalyc can help. Its Alliance Genie supports your clinical judgment by providing those critical reflection insights based on your notes and analysis, all while staying fully HIPAA and SOC2 compliant. You can explore it and start your free trial at Mentalyc.com.
So moving into implementation, the article addresses a really fundamental practical question. How do we introduce this measure without making it feel like intrusive homework or some kind of test?
And the advice is brilliant. Frame the GSRS not as an assessment, but as a confidential, collaborative tool meant to enhance everyone's group experience. The recommended phrasing is just pitch perfect. I'll ask you to fill out a quick form at the end of each session. Please know this is not a test. It's a confidential way for you to give me feedback about your experience so I can make sure the group is as helpful and relevant as possible for everyone here.
That framing is so empowering for clients. It gives them ownership over the process. And this is especially vital for those quieter participants who might feel, marginalized by more dominant voices in the group. Their anonymous feedback ensures they still have a voice, even if they don't speak up much during the session itself.
But let's look at the flip side, the bias issue. What if you have a client who is really motivated to please you, the leader, or just suffers from a positive response bias? They might consistently mark a perfect 40 every single week. That's not necessarily a success. That could be avoidance or people-pleasing behavior.
And that requires our clinical skill to interpret. We have to remember, the GSRS is a starting point for dialogue, never a final judgment. If a client scores a 40 every single week, that high score now becomes the signal. The therapist can use that data to gently explore that avoidance, maybe one-on-one, asking something like, I notice you consistently feel the group is a perfect fit. If you could change just one minor thing about the topic or the approach, what might it be?
So you're using the data to direct your inquiry without putting them on the spot, and you're maintaining that collaborative spirit. It's a very subtle but powerful way to use the tool.
It also means we have to follow up immediately on low scores. If client B scores low on overall fit, the therapist has to dedicate the start of the next session, or maybe a brief one-on-one check-in, to address that specific dimension. That immediate response reinforces the client's belief that their feedback is genuinely consequential.
So what does this all mean for the clinicians starting next week? The most immediate application, it seems, is integrating this feedback loop into your session process. By consistently using those low scores, or even a worrying pattern of consistently high scores, as explicit invitations for collaborative course correction, you're ensuring therapy stays client-centered and sensitive to individual needs, even within that complex group environment.
And that reframes the entire supervision model, too. Given the robust evidence that GSRS scores can predict early treatment outcomes, it raises a really important question. How might routinely capturing this specific client feedback inform professional development for group therapists? We're moving from a supervisor asking, what did you miss, to what did the data explicitly tell you to adjust in your technique for next time? That's a much more productive path to growth.
That's a really powerful path forward. If you want support tracking these complex, multi-layered alliance patterns across sessions, and you want to streamline the documentation of all that essential group work, Mentalyc's Alliance Genie and the AI Note Taker can help you focus less on the charting and more on the therapeutic process itself.
Thanks for joining us for this deep dive. We'll catch you next time.